How's this for something that could be hazardous to your health? The combination of one highly contagious virus and one very contentious political campaign. Our cover story is reported by Martha Teichner.
You just breathe the air, and that's how it's passed.
The date of Bob Woodward's bombshell recording, February 7th, is important.
This is deadly stuff.
President Trump knew then the threat of COVID-19 and had no qualms about downplaying it.
We don't want to have to show panic. We're not going to show panic. And that's exactly what I did.
But panic tanked the markets.
Check this out. We are off 900 points.
February 25th.
The Dow really taking it on the chin.
A disaster of a down day.
We are on pace for the fourth worst points decline for the Dow in history.
Capped by CDC Dr. Nancy Messonnier's coronavirus warning.
We are asking the American public to work with us to prepare in the expectation that this could be bad.
I'm going to be putting our Vice President, Mike Pence, in charge.
No fan of bad news. The following day, President Trump announced his own coronavirus task force. And control of the COVID message shifted from the CDC in Atlanta to the White House.
When you have 15 people, and the 15 within a couple of days is going to be down to close to zero, that's a pretty good job we've done.
Was that when it happened?
USA! USA!
Was that when politics, when partisanship?
We don't want your shutdown anymore!
Became the lens through which Americans began viewing the pandemic?
It's a little shocking to see so many people not wearing protective masks, not staying 6 feet apart.
We thought that the more worried people were about COVID, the more likely they were to be following all the kind of public health best practices, and that's not what we found.
Shana Gadarian is an associate professor of political science at Syracuse University.
What we found was that the biggest divider in people's behaviors was not their age, not their demographics, not their education, it was their partisanship.
Gadarian and two colleagues have been surveying Americans' attitudes toward COVID-19 since March. Look at mask wearing, even hand washing. Democrats and Republicans diverging as much as 20%. As states opened up, the gap widened.
Messages from health leaders like the CDC were rapidly changing over time, and that's very hard for people to keep up with. So they have to turn toward those kinds of experts that they believe and that they trust. And in this case, the kind of message from the White House was dominating.
If politics is about winners and losers, during the COVID crisis, the CDC has lost big time.
There was a problem with the test kits, but they think they've fixed the problem.
Starting with the slow, botched rollout of its test kits. And then its about-face on whether we needed to wear masks.
I ran emergency response at CDC for 4 years. There was never a response I was involved in where we didn't make mistakes.
Dr. Richard Besser spent 13 years at the CDC and was acting director in 2009 during the swine flu epidemic.
It's hard to predict that if this goes away, whether it will come back more severe.
He now heads the Robert Wood Johnson Foundation.
What was different in this situation was that CDC wasn't out there every day being able to explain.
The CDC's director, currently Dr. Robert Redfield, is one of its only political appointees.
I really do think it's important to clarify this as we...
By mid-March, Redfield had all but disappeared from the president's daily coronavirus task force briefings. Since then, CDC guidelines on reopening the country...
Open our country, open us up, we need to work.
...varied. On schools.
We have social distancing as best that we can.
On testing, watered down.
When you see the fingerprints of politics in the public health recommendations, that's a real problem. And it's a problem because it makes it hard to then discern what's being done for political reasons and what's being done for public health reasons.
In this unprecedented Washington Post op-ed, Dr. Besser, along with 3 other former directors of the CDC, charged that the undermining of the agency is actually killing Americans.
I mean, it's just amazing how we as a nation have lost our way and have begun politicizing things that, in the past, there was consensus on. And we're seeing more and more of that.
Dr. Georges Benjamin heads the American Public Health Association, which rallied 347 of the nation's most prestigious health organizations in support of the CDC.
Politics plays a role in lots of things, but if people think that is your primary purpose, then they're always suspect. And it gives people who don't want to participate the wiggle room not to do it.
This is a sign of control.
To openly defy restrictions they don't like.
We believe this is an infringement on our constitutional rights.
Even to attribute political motives to public institutions. Trust that the CDC is providing reliable information about the coronavirus has dropped dramatically, regardless of party affiliation, since April. Roughly 4 in 10 Americans think that during the Trump administration, the CDC and the Food and Drug Administration are paying too much attention to politics. The president last month stoked that sentiment, accusing the FDA of slow-walking the testing of COVID vaccines and treatments to harm him politically.
You have a lot of people over there that don't want to rush things because they want to do it after November 3rd.
He was pushing convalescent plasma as a COVID treatment. And guess what happened?
I'm pleased to make a truly historic announcement in our battle against...
Just before the start of the Republican National Convention, the FDA granted emergency authorization for its use.
So some people say the optics either look like politics or pressure. What do you say about that?
FDA Commissioner Dr. Stephen Hahn defended the decision.
The professionals and the scientists at FDA independently made this decision, and I completely support them.
So is the FDA the new CDC? Its integrity and independence in question?
The head of the FDA confirmed with us tonight the FDA would consider emergency approval for a COVID vaccine before clinical trials are completed.
Remember, the FDA has to approve any coronavirus vaccine for use in the United States.
So we're going to have a vaccine very soon, maybe even before a very special date. You know what date I'm talking about.
In spite of assurances to the contrary, current polling shows that Americans, overwhelmingly Democrats and Republicans, worry that the vaccine approval process is being driven more by politics than science.
Would you get it? Well, I think that's going to be an issue for all of us. I will say that I would not trust Donald Trump.
And you knew this was coming. The prospect of a pre-election vaccine heated up the presidential race.
They're trying to disparage it. They're trying to make it politics. They're trying to do so. And now what's going to happen is we'll have it, and people won't want to take it. That's really bad, okay? That's really bad.
He's undermining public confidence. But pray God we have it. If I could get a vaccine tomorrow, I'd do it. If it cost me the election, I'd do it. We need a vaccine, and we need it now, as quickly as we can get it. But we have to listen to the scientists.
With every aspect of coronavirus politicized already, it should surprise no one. A vaccine that could end the pandemic has been weaponized.